I've been chief of staff of several hospitals here. I was involved in the politics of the doctors in the hospitals, but my main work was practicing as a consultant to other doctors in the field of infectious diseases. I was fine, except fine up to one day when I was watching TV at home and I couldn't breathe because I knew what was happening. And as soon as I got to the hospital, I was given the right medication and I was diagnosed with having a myocardial infarction or a heart attack. The recommendation at the time was to get coronary bypass surgery. I was home recovering from the heart surgery when one morning I was alone in the house that particular day, and I went to sleep normal, but I woke up on the floor the next day. Then I called my secretary and I said, something has happened here. I woke up on the floor and maybe you should come pick me up, take me to the hospital. At the hospital, I was seen by a neurologist who immediately diagnosed that I had a loss of a visual field, the right visual field, and that I had a stroke. The visual loss was probably permanent and there was nothing to be done about it. Well, I did nothing for a couple of years, 3-4 years, because there was nothing to do. I could not find any treatments offered until I found out by searching in the internet I found out about NovaVision visual restoration therapy. The stroke happened 10 years ago, the therapy about 5 years ago. Well, my first experience with this was at the office of Dr. Romano in Miami, with the University of Miami. I did start seeing progress in terms of what I was seeing in the screen. I felt like I was seeing more on the right side where I had the visual field loss, and that was confirmed by the people analyzing the results. The main thing that I noticed, other than I was seeing more, was also that I was able to read better. One of the problems of having the right hemianopia, since we read from left to right, is that I could not read very well. I would miscue a lot of words, so I developed what I call a dyslexia, because I was unable to read fluently. And I noticed that improved significantly with the improvement in the visual field. Oh, it made me feel great that I had actually improved and that I was actually able to do things that I was not doing very well before. Well, specifically going to movies, watching television, reading, these are pleasant activities that I was having a lot of difficulty with, and I had less difficulty now. To me, that was great news. When you have a problem and you find that source after source of very highly qualified people tell you there's nothing that can be done, and then you find that there's actually something that might help, and you actually do it, and it does help, that is a very gratifying feeling. The neurologist who was seeing me here was impressed by the fact that I had this improvement. In my case, it has. In my case, it was very successful in getting me to a better place than where I was when I started. So I'm very pleased that I did the therapy, and I'm very pleased with the results. Oh, tremendously. I mean, one of the things that I really enjoy doing is scuba diving, and I do underwater videography, and it helped a lot that I was able to look around and have a better, be able to see better what I was going to do a video of. And I have done a lot of underwater videography since this happened, and that's one of the hobbies that I really enjoy. I believe this therapy, if you're motivated and you put in the time that it takes and the effort that it takes, should help a significant number of people who do it. I was probably as motivated as a human being can be. I was very motivated. Don't take no for an answer. Uh, Even if it sounds like there's nothing available, keep looking and keep searching, because that's how I found this particular therapy that did help me in the end.